Right, so why do I say weight loss surgery is a temporary fix? It really is. We've seen any type of weight loss surgery, from the most simple procedures to the most advanced and most invasive procedures, fail. And it's not an infrequent event. Up to 10%, 15% of the surgeries fail. And when you're out 5 years, they can actually fail even further. So why do we call it a temporary fix? It does depend a lot on the patient's attitude towards the procedure. If a patient is getting surgery and expecting the procedure to do all the work, what's going to happen is that that procedure is going to fail. A procedure, any given procedure, works around 60 to 70% effectiveness. If a procedure is used as a tool and the patient helps it out, say by adding his or her effort, being proactive about the weight loss surgery, and add a little bit to it, like 30%, well, you're going to end up 60, 30%, 90% excess weight loss. But if the patient just sabotages it 30%, you're going to end up with half of its ability to lose weight, like 30% excess weight loss. A procedure that works 60%, if you sabotage it 30%, you're going to end up with 30% success. And what that translates to is that if you're 100 pounds overweight and a procedure works 60%, well, you're going to lose 60 pounds. If you add to it 30%, you're going to lose 90 pounds. If you sabotage it 30%, you're only going to lose 30 pounds. And that's where a lot of patients start talking about, well, it was the procedure I selected, it was the center, it was the device, it was the surgeon, etc., etc., etc. And it's time to be responsible for your actions. You're getting weight loss surgery. Weight loss surgery is a tool. And what I tell all my patients is that if you're expecting the procedure to do everything, you're of course going to select the most aggressive procedure. You're not going to care about how risky it is or the side effects. You're going to want the one that works the most because you don't want to do anything. And those are the patients we see failing. At the end of the day, in a perfect world, even though surgery is not what you would desire for weight loss, it's the only thing that's proven to work, you would want a procedure that's working with the patient hand in hand to get to your weight loss goal. So, like it says in this article, ask yourself in the mirror, it's time to ask yourself, am I doing my part?